Hi, everyone. I'll just go ahead and get started. I'm sure people will start trickling in slowly, but just to make sure we have enough time, I'm going to kick us off. Hello, my name is Nellie Sabor, and I'd like to welcome you to the Autism Intervention Research Network on Physical Health July 2023 webinar on autistic stakeholders' perspectives of a flourishing survey measure. So thank you for joining. Because of the number of participants, your audio will all be muted throughout the call. However, you can submit any questions at any point during the presentation via the Q&A feature or in the chat box on your webinar console. And just a friendly reminder to please be respectful when communicating in the chat, asking questions, and note that only questions or comments pertaining to the presentation will be addressed. The entire webinar is being recorded and will be available on our site, and that I will put in the chat. You'll also, you can view the slides to follow the presentation on the Google Drive that we'll put in the chat box as well. There will be a short evaluation survey at the close of the webinar. We invite you to provide feedback on this webinar and also to provide any suggestions for future webinars. So in the interest of time, we'll go ahead and get started. Next slide, please. First, want to acknowledge the Health Resources and Services Administration as the funding source for the AARP. Next slide, please. Now it is my honor to present or introduce our presenter for today, Dr. Samantha Ross. Dr. Samantha M. Ross is an AARP scholar and an assistant professor for the adaptive physical activity in the School of Sport Sciences at West Virginia University. Dr. Ross aims to enhance the well-being among children with disabilities through physical activity participation experiences. Her current scholarship supports this goal by 1, evaluating population level measurement practices to effectively identify and monitor positive health behaviors of children with disabilities, and 2, engaging in capacity building efforts to facilitate research co-constructed with disability community members. Dr. Ross applies a critical disability studies lens when investigating current practices within her field, and was recognized as the 2023 Howie Poindexter Young Scholar by the National Association of Kinesiology in Higher Education. So without further ado, Dr. Ross, please take it away.
Wonderful. Thank you, everyone, for having me here. I'm excited to share what we've been working on as part of the AARP Scholars Project. I'm going to start by introducing a few key terms that we'll circle back to as we talk through some of the research projects and our findings. Today, we're talking about flourishing, which is a concept for positive mental health. And I'll go into detail on that on the next slide. And we're looking at flourishing items that are in the National Survey of Children's Health. We're going to use those national survey measures to examine some disparities or differences in flourishing outcomes between autistic children and adolescents and children without autism. But we're going to take a critical look at whether this measurement is a good measure and is in fact reflecting true differences between these populations, or if our measurement tool is biased in some way or poorly reflecting the experiences of autistic youth. We're going to take that critical look and engage stakeholders, autistic youth and their parents through cognitive interviewing to better understand how these survey measures for flourishing are meaningful to this population and reflect their health experiences. And we'll wrap up by talking about focus groups, where we've gone back after cognitive interviewing to learn more from autistic youth and their parents about how we can revise these questions to make them meaningful and relevant to measuring flourishing. And we engaged autistic youth in helping us build a conversation toolkit around flourishing and included a graphic recorder within that team who's started to illustrate and help us make an infographic that we will make publicly available. So flourishing is a concept, it's a broad concept that's not yet well defined, but was introduced as an idea of positive mental health. So on the screen is a spectrum, starting in the upper left-hand corner in the red is mental disorders or the absence of positive well-being and poor functioning. And as you move up the spectrum, it begins to represent more positive experiences in emotions, relationships, and functioning, with flourishing being in the green box at the end of that spectrum. Traditionally, in health models, when we look at national surveillance, we've focused in the mental disorder or the poor functioning domain of mental health. So measuring if teens are engaged in smoking or risky behavior, with the assumption that the absence of those behaviors represents positive mental health. However, we've moved or shifted our paradigm to now reflect that it's not just the absence of those behaviors that indicates positive mental health, but there are certain behaviors we engage in that are additive, that represent positive relationships, engagement in our community, achievement and goal setting, that pushes you from just having good or moderate mental health into that flourishing or thriving domain. For adolescents, being or experiencing flourishing is associated with fewer school problems, less likelihood to try drugs or risky behaviors, a higher likelihood that you're choosing to participate in healthy environments, and greater academic outcomes. And we also have seen from a body of research that children who flourish in childhood and adolescence are more likely to engage in these behaviors as adults and have more positive lifelong health outcomes. So adolescence is an important part in which we might start developing these behaviors and associated with those immediate outcomes as well as lifelong outcomes. The National Survey of Children's Health in 2018 added survey items that would help us measure at a national level how many children in the US are experiencing these flourishing outcomes. In general, the National Survey of Children's Health is a caregiver-reported survey, so parents and caregivers are called by the CDC and Maternal and Child Health Bureau survey representatives to report on their child's health experiences. This includes health diagnoses, health service use, experiences in the neighborhood, demographics, and so forth. It's a survey that's nationally representative of children in the US birth to 17 years old, and those data sets are publicly available for researchers and state representatives to use. Topics of the National Survey of Children's Health include overall health status, healthcare utilization, family functioning, school experiences, and neighborhood characteristics. And I'll speak on the next slide to how our Hilton and colleagues as researchers pulled from these survey items across these domains to create a set of 10 items that are intended to represent flourishing among children and adolescents. One of these questions examples is on the screen on the right, and it asks parents to report, compared to peers your child's age, how much difficulty does your child have making and keeping friends? And the response options include no difficulty, a little difficulty, or a lot of difficulty. And we'll look at a few more examples and then talk about how those get scored to represent positive flourishing. Hilton and colleagues in 2019 did an extensive literature review looking at current research to identify what factors or what behaviors do adolescents engage in that represent flourishing or this positive mental health experience that would indicate children are thriving, engaging in positive social relationships, working towards achievement in work and school, and engaging in positive behaviors for their health and well-being. From the National Survey of Children's Health, They identified a 3-factor model, or 3 main topic areas that would capture flourishing behaviors for adolescents. These included social competence, which represents the ability to use social skills and manage emotional response in social interactions to meet your individual needs. They also captured behavioral control as another part of flourishing that represents curiosity and learning new things, while also emotional regulation when faced with challenges. And the third domain they recognized important for adolescent flourishing is school motivation. So interest in doing well in school and completing homework. These 3 factors are then represented by 10 survey questions within the National Survey of Children's Health. The social competence domain is represented by 4 questions, 2 of which ask about bullying, how often your child is bullied, and then how often your child is the bully. A question about arguing too much, and that question example that we looked at earlier in terms of how much difficulty they have making and keeping friends. The behavioral control domain is represented by 4 questions. The first being, how often does your child show interest and curiosity in learning new things? How often do they finish tasks they start? How often do they stay calm and in control when faced with a challenge? And how often are they able to share and talk about ideas that matter to them with a caregiver? Finally, the school motivation domain is represented by 2 questions in the National Survey of Children's Health. The first asking, how often does your child complete all required homework? And the second question asking, how often do they care about doing well in school? On the screen are 3 examples of questions, one from each domain, and how they would be scored as representing positive flourishing for adolescents. In the social competence domain, the example we're looking at is how much difficulty your child has making and keeping friends. Reporting that they have no difficulty would be scored as a positive 1 point and represent that the child is flourishing. Whereas reporting that they have a little or a lot of difficulty would suggest that they have poor or are flourishing less. In the behavior control domain, we have how often does your child show interest and curiosity in learning new things? A parent reporting that their child always or usually shows interest would be a positive point and an indicator of flourishing. Same with school motivation. If a parent reported that they always or usually care about doing well in school, that would be a +1 point towards that overall flourishing score. Hilton and colleagues who developed this 3-factor model using the National Survey of Children's Health looked at differences between children with and without autism to see if this group is experiencing poor flourishing or risk for some of these less likely to be engaged in these behaviors. On the screen is their summary table, figure 2 in their paper, that represents the overall or average score of children with autism compared to children without autism as reported by parents in the 2016 National Survey of Children's Health. This data set included 34,000 children across the US, of whom 812 reported a diagnosis of autism spectrum disorder. On average, children and adolescents with autism, we're looking at like the 6 to 12 year range, had an average score of 8.76 in the social competence domain, which we just reviewed was represented by 4 questions on the survey. This was compared to children without autism who had an average score of 9.9 in this domain. This difference was determined to be statistically significant, with children with autism having a lower score or less likely to be demonstrating positive social competence to represent that positive flourishing or positive mental health outcome. A similar trend was observed in the behavioral control domain. Again, this represented children showing curiosity and interest in learning new things, or maintaining calm and control when faced with a challenge. Children with autism on average had a score of 8.1 in this domain compared to children without autism who had a 9.1, and that difference was statistically significant. There was not observed to be a difference in the average score within the school motivation domain between autistic youth and non-autistic youth. So Hilton and colleagues concluded that children with autism have significantly different and lower scores in social competence and behavioral control compared to children without autism, representing poor flourishing outcomes, or less likelihood to be engaging in flourishing behaviors in this population. And given evidence that flourishing is associated with poor academic scores, lifelong health, and mental well-being, they concluded that children with autism are at greater risk for that decreased mental health outcomes, social and psychological well-being. And this may lead to reduced adult independence, given that those adolescent behaviors predict lifelong health and well-being. Our research team wanted to take a critical look at this conclusion to question whether or not the assumptions underpinning the tools in which we're using to measure flourishing are in fact a culturally relevant and meaningful representation of flourishing behaviors and outcomes among autistic youth. So are these differences where we are seeing lower scores among autistic youth representative of poor outcomes or of differences in behavioral experiences of flourishing? And can we really say that they are doing less well? Or is our measure not giving us the tools we need to capture and represent those differences in experiences in a meaningful way? So we ran a study that examined or tested for measurement bias within this 10-item survey set from the National Survey of Children's Health. Measurement bias represents a systematic difference in how individuals are responding to question items based on a given factor. So we would assume, if it is an unbiased survey, that children who have the same overall flourishing score or summary score are showing similar patterns of responses to each of the 10 items. So if you're scoring high, you have a similar response pattern to another child who is scoring high in the overall score. If there is measurement bias, then children with the same overall score, so 2 kids that are scoring high, will have different response patterns to the 10 items based on whether or not they have autism or do not have a diagnosis of autism. So this difference in pattern would suggest that something about the way parents of children with autism are interpreting these questions or making meaning of the answers is different from parents of non-autistic children. And this would be problematic because we would interpret as Hilton and colleagues did, that difference represents a deficit in flourishing, where in fact that difference might be just how we're making meaning of the questions or what those questions are representing. So if there is measurement bias and parents of autistic youth are interpreting these questions differently or making meaning of how they respond to those questions, then we may be unintentionally pulling down or negatively scoring autistic children in flourishing and artificially representing differences between autistic youth and non-autistic youth. For example, autistic youth may have repeated or restricted interests. That's one of the diagnosis categories for autism spectrum disorder. One of the questions on the survey is, how often does your child show interest and curiosity in learning new things? It may be that an autistic youth shows a lot of interest and curiosity in expanding their knowledge and engagement with a very specific and limited topic or hobbies. So would a parent have a difficult time choosing an answer on this scale, where they may not always or usually show interest in new things, but they are learning in depth about a particular topic of interest? So a parent may score sometimes on this scale, but not consider that to be representative of negative flourishing for their autistic youth. Whereas general researchers would score that sometimes as a negative point. So this idea that behavioral characteristics of the diagnosis may result in a lower score is considered a disability penalty and would result in a biased measurement. This is also where we have to take a critical look and consider, are these measures embedded in ableist ideas, where we are using a quote unquote normative standard or the neurotypical behavior pattern as the indicator of health and well-being, and anything that differs from that is marked as poor health and poor well-being. So that's where our critical lens comes in as researchers, and where our research question really evolved from was, is there true differences in this population, or are our measurement tools biased and not accurately reflecting the positive well-being experiences of autistic youth, either in the way we ask the question or in the way that we score the question? So we ran a statistical analysis to test for measurement bias. And I'm going to briefly discuss this analysis outcome on the screen. That looks a little daunting. But if you are really interested in the mathematical and statistical side of it, I'll refer to our published paper listed at the bottom of the screen. But I'll briefly talk about what we did, and then more importantly, spend time discussing how we interpreted it and what did the data inform us of. So to evaluate for a measurement bias, we ran a multiple indicators and multiple causes model, which is a form of a confirmatory factor analysis. And the goal of this analysis is to partial out the variance in our flourishing outcome that we can attribute to having autism. The link, would you like the link for the slides or the link for the paper? Okay. Yes, I will circle back and pull out the link to the paper. But the title of the slide is found in the slides that Bree just posted. So what we were able to do here was after accounting for all other confounders, so sex, age, parental education and income, neighborhood safety and characteristics, childhood, adverse experiences. After we took out all of those variables that might account for differences in flourishing outcomes, we asked for 2 children who have the same score, overall score, do their responses on each of the items differ based on whether or not they have autism? And what we found is, yes, for some of the items, there is evidence of measurement bias, which is represented by the beta statistic or estimate on the screen. And again, that's explained with some interpretation in the paper. But briefly, what you would do with this beta estimate is square it. So for friends, the negative 0.26, when you square that, it represents the percentage of variance accounted for by an autism diagnosis. So about 6% of the variance, or the differences in how people are scoring on the friendship question, can be explained by whether or not the child has an autistic diagnosis. Another way we might interpret this is to say that caregivers of autistic youth are significantly more likely to endorse lower or less favorable responses for each of these items compared to caregivers of non-autistic children, when their children have the same overall flourishing score. So this is problematic because your measure is no longer capturing differences in flourishing behaviors between children. It's the differences as actually in part representing autism. So they're being penalized for having that diagnosis. But we don't know why we're seeing differences in response patterns or where the cause of this measurement bias is. It may suggest that caregivers are interpreting the items and the questions differently, or that they're making sense or making meaning out of those questions differently when they think about how it may relate to the experiences of their autistic children. So making and keeping friends may contribute to flourishing differently for autistic youth than non-autistic youth, or the way we score them may reflect different levels of flourishing for these groups. So to better understand how parents are making meaning of these questions and how we can help researchers better revise those questions or interpret how we score them, we engage stakeholders in evaluating the 10-item set. And we did this by conducting cognitive interviews with parents of autistic adolescents ages 12 to 17, as well as interviewing the autistic youth themselves to get some first-person perspectives on what do these questions mean, what do they represent, are they important, are they meaningful, would you consider them to be an indicator of flourishing or positive mental health. This project was funded by an AIRP Scholars Grant. So very exciting to be back here and sharing that outcome and to have received support from this community in exploring this in more depth and being able to connect with people within the community and stakeholders in exploring this concept. Our research team included an autistic youth who self-identified as a community research assistant. So really exciting to be able to have an autistic youth interviewing and engaging with autistic youth participants to build that rapport and also to gain insight into those experiences and that dialogue. Additionally, we had graduate research assistants who had professional experience in educational settings working with young adults with autism. So cognitive interviews are a strategy for understanding how people answer survey questions. So on the screen, we have an example of one of the question items, which is how often does your child show interest and curiosity in learning new things? The response options are always, usually, sometimes, and never. So in a cognitive interview, the researcher would sit with the participant and ask them to answer this question, and then ask follow-up questions about, well, what did this question mean to you? Can you repeat it in your own words? What did you think about when answering this question? Was it easy or hard to pick an answer? Is this question important to you? Why is it important to you? So by asking and kind of working through a dialogue of almost having the participant think aloud as they answer it, the researcher can better understand, is this question clear? Is it confusing? Is there an answer that represents that person's experience that they could easily identify? Or was it difficult to choose and there might be an issue with clarity or an issue with representation or relevance of the question to the participant? We interviewed 16 parents of autistic adolescents aged 12 to 17 years old, as well as their child, and ended up with 16 dyads, which was exciting because we were able to really look at a comparison of parents and youth's answers, as well as get an understanding of how adults are interpreting these questions relative to adolescent youth. I apologize, this is a repeated slide. The cognitive interviews ranged in time, but were usually about 60 minutes and were hosted online using a Zoom platform. Participants were given the option to respond verbally in the Zoom call or use text responses as a way to create a more inclusive and accessible opportunity to participate. They had the option to have their cameras on or off, and were sent the interview questions 48 hours in advance to provide time to read, review, and process prior to our discussion. Parents were interviewed separate from children, but children were always given the option to include a caregiver or a support person within their interviews to increase their comfort, as well as support any communication needs. So we'll talk through some examples of the responses from the cognitive interviews represented by youth and their parents. So again, Flourishing has 3 domains: the social competence, the behavioral control, and the school motivation. And we're looking at one question item from the school motivation category. That was, how often does your child care about doing well in school? With the options of always, usually, sometimes, and never. So one youth participant answered always. They always care about doing well in school. And they equated that to representing 95% of the time, or most of the time. And they say, I'm really, really upset when I don't care about my grades. And that has not happened, because that would be a really low point in my life if I did not care about my grades. So as researchers, we interpreted this statement as suggesting that 2 kids doing well in school means getting good grades, and that is important to them and reflects positive well-being, because this participant self-reflected that not caring about grades would be a low point in their life. So in a way, this question is meaningful to autistic youth and representative of positive well-being. A parent participant responded or shared when answering the same question. I guess it's important to me, and that would be in reference to their child caring about doing well in school. There's a part of life that you might not enjoy, but you have to do it. So you have, I'd like him to do his best and give his best. So I guess that's something I would definitely like to see him work on. What we found for parents in reporting about doing well about school, they thought more broadly about showing up to learn, caring about doing well because it will impact the child's future. So building good habits, completing work, having a good social experience, and overall being successful at school. Whereas children tended to talk about specifically grades as representing doing well. But for both, this was an important question that they felt was representative of a positive experience. We were interested in how likely it was that parents and youth would score the same on these items. And so we used the youth's response as the reference point. So in this example, if the youth responded usually, we then scored their caregiver's response relative to that. So if they scored always, that was a +1 because the parent scored one more category favorable than the child scored themselves. Whereas if the adult had said they never care about doing well in school, that would be 2 categories in the negative direction away from the child's response. For the question, how often does your child care about doing well in school? We saw that 67% of parents scored the same or within one category of their child. So in the majority of responses were similar. And that remaining 30%, we saw split kind of between having more negative or less favorable responses compared to their kids versus responding more favorably. There was similar agreement across the social and behavioral domains overall, where 75% of parent responses matched or within one category of their child, and 86% of the time that was true for the behavior-related questions. What was interesting for us as researchers was that the social domain had the largest range of agreement. So parents ranged from being 3 away from their child in the positive direction and 4 away from their child in the negative direction. So a larger discrepancy in answers. And also had the largest percent of parents who scored their child less favorably than they scored themselves. So 30% of parents' responses were more negative in relationship to the social questions about making and keeping friends, being bullied, and arguing. So similarly, we have an example here in the social domain. How much difficulty does your child have making and keeping friends? No difficulty, a little difficulty, or a lot of difficulty. One youth participant reported that when it comes to making new friends, I kind of choose not to. So there's a preference there, but it is somewhat difficult. So I guess I'll say a little difficult on that. But when it comes to keeping a smaller friend group, I'd say I do pretty well with that. So for them, they are doing well with the small group that they have, and they saw this as a positive. And they differentiated between keeping friends and making friends, even though the question combines those two. This youth's participant scored them as having a lot of difficulty, and their response shares that they may have a difference in how they interpret or consider friendships. So their parents spoke about going to birthday parties together, but not having kids over during the week. And mostly those play dates are set up by the parents. So this parent felt like he doesn't have friends, but isn't sure how to answer the question, suggesting that there's some confusion or difficulty in interpreting and making meaning of this question for their child. So overall, we saw that there's agreement that making and keeping friends is important for autistic youth and their parents, but there may be differences in how we relate meaning to the word friendship and how we score or interpret doing well in that area, and what the preferences are of the youth for wanting to make and keep new friends. So based on those cognitive interviews and recommendations from parents, we considered adding questions about child's preferences for making and keeping friends, having small friend groups, sustaining relationships, as well as clarifying positive peer relationships as friends or positive peer in encounters at school or in other situations to explore in more depth those experiences of friendship and that contribution to positive well-being. So in the second round, we've taken back those suggestions and are now engaging currently in focus groups to say, what do you think of these changes? Would you add to them? Does that help clarify the question and better represent the experiences? A big one was, how often does your child complete required homework? And for many children, they are homeschooled or all work gets completed at school. Teachers are not sending it home. So it was difficult to make meaning of that question, and parents wanted the option to have a not applicable or to change the word to how often do you complete schoolwork. So it's those changes and those interpretations that we are now exploring, again, with the help of parents and autistic youth, to help solidify what those changes should be and how we can help inform how we interpret the scoring of those questions. And alongside that, we are asking autistic youth to co-create or co-produce a conversation toolkit with us. So because we saw differences in scoring between parents and youth and differences in how we interpret what it means to care about school or what it means to engage in positive friendships, we want to help facilitate conversations between parents and youth to talk about these experiences and where we might be able to support them. So they're working right now in their focus groups to help create an infographic. Again, asking more questions about, is this important to you? What does this mean to you? What can parents ask you about this if you are not doing well in this area, or if a friend is not doing well, to try to help engage and help them be the leaders in that discussion. We're using a co-production method, which is a form of participatory research where we promote the autistic youth as the lead collaborators and the producers of knowledge in this process. And to help support that interpretation and that lead, we have a graphic recorder as part of our focus groups. And what the graphic recorder does is illustrate the conversation or discussion as it's happening. So each of the kids get to pick an avatar. Here you see them represented by a cat and a person. So that's then their contribution on the screen. And then he tries to illustrate some of the discussions as they're happening, to to guide our discussion and help take notes. And as we work through each of the domains in the question set, we've got this kind of brainstorming illustration that we'll be able to pull from to create an infographic that will then be shared with participants for their feedback. And that is where we currently are in this research process and continuing to ask those critical questions about our measurement tools. And I'm happy I will share more of those resources and happy to answer questions. So thank you.
Thank you so much for your presentation, and your work on this area was wonderful. We now do have some time for questions. So I'll start with a question that was submitted in the Q&A function on Zoom. It's from Desiree. Her question is, my work is focused on autistic adulthood. How do we better identify or address albinism and identified measures? Is there a guide or further checklists?
Yeah, I think that's a great question. And that's something that really drives my work. So would love to kind of follow up in a conversation with you. There are, I think, conceptual ways that we explore that when we go and we look at these questions and we ask, is this question scoring people poorly if they have a diagnosis or they have like a functional impairment? And there's no way for a person with a diagnosis or a functional impairment to score 100% on your measure, then you have created a biased assessment, because you would anticipate that you can flourish or you can have positive well-being with a disability. And we've seen a bit of this work I'm happy to share from Gloria Cron and others who have looked at quality of life and health measures for the same kind of disability penalty. And what is the standard outcome, or what is the expected outcome we're looking for, and is that achievable by all participants? Or are we assuming and tying into our questions that those with disabilities will not score high on this test? So that's like conceptually. And then what we did statistically was to just reinforce that question, or to test for ableism in that way, that we statistically showed that the questions are producing different response patterns based on disability status. And we as researchers think that that is problematic. So we hope that that statistical test will help generate a conversation in which we can explore that further.
We have one more question in the chat. What are your next steps for this research?
Excellent question. So we hope that coming out of the focus groups, we will have an improved survey, or that either has revised questions or has additional questions that help us capture more in depth the flourishing experiences of autistic youth. And hope that we can pilot that survey. So go out and recapture among a population sample of adolescents with autism and see where we are continuing to see gaps in these flourishing behaviors. So that might inform interventions or extended resources, and where we're also seeing strengths in flourishing. And then can we identify what factors are contributing to those strengths and those positive outcomes for that group in order to share and extend those resources. And then of course, we want to continue engaging with the community to identify what additional resources might be supportive, or what questions might grow out of this, either in an educational setting, in an adult setting. One of the things is that I say adult and I shifted gears there. This is a parent-reported survey. So we did translate it into a person-first questionnaire. So how often do you care about doing well in school? but I'm not sure if all of those questions were age appropriate. So that might be a next step too, is if we can generate a self-report survey of autistic youth on the topic of flourishing, based on what they've self-identified as important and representative of that scale.
Well, while I give a few people maybe a moment or two to ask any additional questions if they have any, I just wanted to invite everyone here to register and attend our August webinar for next month. It'll be presented by Dr. Regina Wilson. We can throw a link up for registering for that webinar in the chat. And then, of course, if you have some time, please complete our feedback survey, which is on the screen. You can access that by the QR code, or the link is also in the chat. If there are no additional questions, I'd like to thank you for attending this webinar. I'd like to thank you, Dr. Ross, for presenting. The webinar has been recorded. It'll be archived on our website and on our YouTube channel. So that's it. We'll see you next month, hopefully. Thank you.
Thank you.